While the standard treatment options for spindle cell mesothelioma including surgical removal, chemotherapy, and radiation can be effective for some, they often provide only modest benefits and come with significant side effects that reduce quality of life. As a result, many patients explore alternative and complementary therapies to help manage their symptoms and potentially strengthen their body's ability to fight the cancer. Below are some of the more promising alternative treatments being studied or utilized by some patients and doctors. Nutrition and lifestyle changes. Adopting an anti-inflammatory, whole foods diet rich in fruits and vegetables, lean proteins, and healthy fats has numerous benefits. Making sure to stay well hydrated, manage stress through activities like yoga, meditation, get moderate exercise daily, and get enough sleep are also important for overall well-being. Supplementing with antioxidants like turmeric, broccoli powder, or green tea catechins may help as well by reducing oxidative stress and inflammation. Herbal medicine. Research is investigating whether Chinese herbs like Huayansu, PHY 906, a mixture of 4 herbs including Scutellaria abicalensis, Ganoderma lucidum, and others can help inhibit tumor growth and sensitize cancer cells to chemo, radiation and mesothelioma. In lab studies, some show anti-cancer activities through immune modulation, antioxidant effects, or direct inhibition of tumor growth, metastasis. Larger clinical trials are still needed. Acupuncture. By stimulating specific points, acupuncture is hypothesized to help relieve pain and symptoms like breathlessness, fatigue, or nausea from mesothelioma or its treatments. It may also boost quality of life and immune function. While research is limited, some small studies have found benefits for symptom control and reduced side effects from chemotherapy when acupuncture is added as a complementary therapy. Hypnosis. Hypnosis involves relaxing the mind and body to focus fully on suggestions given by a trained provider. It may help patients better manage pain, stress, sleep issues, anxiety, nausea, and treatment side effects from a hypnotic suggestion perspective. A few smaller trials have found hypnosis reduced shortness of breath, pain levels, and nausea in some cancer patients when combined with conventional care. Ozone therapy. A form of oxidative medicine, ozone therapy works by controlled exposure to activated oxygen to stimulate immune function and circulation. This is hypothesized to help treat infection, reduce tumor size, and improve symptoms in cancer patients. While promising results are emerging from preclinical studies, significant clinical testing is still needed to validate its safety and effectiveness for mesothelioma specifically. Ayurvedic medicine. The traditional Indian system focuses on balancing the dosas, life forces, in the body. Treatments may include herbal, spice formulas chosen based on dosha constitution, meditative and breathing exercises called pranayama, abhyanga, herbal oil massages, panchakarma cleansing routines, and more. While research is limited, some Ayurvedic modalities show anti-cancer potential based on antioxidant, immune-stimulating, and stress-reducing properties that could theoretically help mesothelioma patients. Hyperthermia. This involves precisely raising body temperature above 101 degrees Fahrenheit via different techniques, infrared radiation, microwave energy, ultrasound, etc., to damage and kill cancer cells. Heat is selectively toxic to tumor cells due to their poorer blood flow and oxygenation. Hyperthermia is sometimes given with chemotherapy to make tumor cells more vulnerable to drug effects. Some small studies on hyperthermia in combination with standard therapy show promise for extending survival and increasing response rates in mesothelioma, though larger trials are still needed. Laser therapy. Low-level laser or light therapy works through phototherapy principles to reduce inflammation, promote wound healing, and increase circulation, oxygenation at the cellular level. It has grown in popularity for pain relief, swelling, and wound care. Some preliminary in vitro and animal research explores use of infrared or near-infrared lasers to kill cancer cells or sensitize them to chemotherapy, but clinical evidence for efficacy in mesothelioma is still emerging. Cancer prevention, detoxification. While mesothelioma often stems from past asbestos exposure, some integrative oncologists aim to reduce cancer risk in survivors or limit recurrence, spreading with programs to assist the body's detoxification processes. These may include sauna detoxification, chelation therapy, using EDTA to remove heavy metals, dietary detoxification, organ support supplements, and more. While such protocols can support long-term health, research into their direct impact on mesothelioma tumor kinetics is still in early stages. While alternative therapies cannot cure mesothelioma alone, many patients report benefits by incorporating complementary and integrative approaches together with conventional treatment plans. The goal is to enhance quality of life, manage side effects, stimulate the immune system, and potentially gain anti-cancer synergy when certain alternative modalities are combined judiciously with standard therapies like chemotherapy. However, clinical research evidence remains limited for most options at this stage, so patients should discuss all therapies and treatment plans thoroughly with